In this video, we're going to take a look at the mechanism of pulmonary ventilation. So take this as your lungs, and then we have this fluid-filled bag that covers the lungs, right? It's called as the pleura. Imagine it like this. So you have a balloon, and what you do is that you take your hand, and then this is your hand, right? So you take your hand and then you press the balloon. So so the balloon will create this kind of shape, right? So the pleura is something similar to this, right? So there is a fluid here, inside the balloon, and there is a outer layer, and there's an inner layer. So it's same as that. So we have the outer layer, and we have the inner layer. So the outer layer we call it as the parietal pleura, and the inner layer we call it as the visceral pleura. And this pleura is an airtight chamber. Airtight fluid-filled bag. Okay, so when you pull on the pleura or the parietal pleura, what happens is that the lungs will be pulled in the same direction, or basically the lung will expand. So with the parietal pleura are connected closely with the thoracic cage or the thoracic cavity or the ribs and the muscles. But the visceral pleura are connected closer to the lungs. So it's like the visceral pleura is glued to the lungs, and the parietal pleura are glued to the thoracic cage. So now we're going to take a look at the muscles and what is the mechanism behind the pulmonary ventilation, how the lungs expand. So when it comes to the muscles, the main function of the muscles of the respiration are to increase, to expand, or to compress the thoracic cage and then as a result increasing the volume of the lungs, or it decreases the volume of the lungs. Or we can call this chest cavity, changing the chest cavity, or So let's take a look at what are the muscles which are used in inspiration, and what are the muscles which are used in expiration. So when it comes to the muscles of inspiration, we have diaphragm, external intercostal muscle, sternocleidomastoid muscles, and then we have the scalene, and then anterior serraty. So the sternocleidomastoid muscle, scalene, and the anterior serrae are called as the accessory muscles, which are normally aren't used in inspiration. Okay. And during expiration, we have abdominis, and during expiration, we have the abdominal recti muscle, and then we have the internal intercostal muscles. And we have the abdominal recti muscle and other abdominal muscles, right? So what diaphragm does is that it contracts. So when it contracts, it goes downwards. So it increases the vertical diameter of the chest cavity. And the other muscle, the external intercostal muscles and the scalene, anterior serrae, and the sternocleidomastoid muscles are going to increase the lateral and the anteroposterior diameter. I'll just show you in a bit, and I'll show you what are the movements which causes the anteroposterior. So what is anteroposterior and the lateral diameter? Think of it as like this. So when you take cross section like this, and then just see it from above, you will get an image like this. So what is the yeah, so these are your lungs. Okay, so this is your right lung, and then this is your left lung. Okay, basically you are seeing it from above, right? So this is your anteroposterior diameter. Okay, this is the anterior, posterior. So it's called as the anteroposterior diameter. And then this is called as the lateral diameter. Imagine this is your vertebra, and these are your ribs, and these are your external intercostal muscles, and you have the internal intercostal muscles. So basically, when a muscle contracts, they pull from both sides, right? So basically what happens here is that, okay, so these are your ribs, and this is your external intercostal muscle. So when they contract from both directions. So the force created by in both ribs are the same force. But the torque created the torque created by the lower rib is more than the torque created by the upper rib. Why is that? You know those equation, right? So when R increases, the torque increases too. So due to that, when the muscle contract, I mean the external intercostal muscle, contract, they move upwards. So vice versa, when it comes to the internal intercostal muscles, the toe in the lower rib are lesser than the toe created in the upper ribs, so they move downwards. So basically, the external intercostal muscles helps to elevate, and then we're going to talk about the buckle handle movement and the pump handle movement. When it comes to the bucket handle movement, this is your handle, this is your bucket. The drawing is terrible, but this is your bucket and this is your handle, and then when you lift it up, the diameter increases, right? Okay, so the same thing happens here. When you lift it up, the diameter increases. But in the pump handle movement, so the lateral diameter increases here, so this is called as lateral diameter. And during pump handle movement, the sternum gets elevated. So what happens, say this is your sternum, and then when it's elevated, the anteroposterior diameter increases. And this is how your anteroposterior diameter and the lateral diameter and the anteroposterior diameter increases. These are your ribs. Sorry. Okay. So these are your ribs, and these are your intercostal muscles. I mean the external and the internal intercostal muscles. And as we have seen that these are the parietal pleura. If I want to say it again, this is like the parietal pleura and the visceral pleura inside. And then we're going to see the mechanism right now. Okay. So when the when the muscles contract, the vertical diameter and the anteroposterior diameter and the lateral diameter increases, as I said earlier. So due to that, what happens is that it's like the parietal pleura gets pulled. Okay, due to the diaphragm, it gets pulled downwards or in the vertical direction. And due to the intercostal muscles and the sternocleido and the other muscles, it gets pulled in the anteroposterior diameter and then the lateral diameter. Okay, so due to that, we have a negative force. Okay. Yeah, so I just forgot to mention that in the pleural cavity, there's always a negative pressure. Okay, it's like a suction pressure, because there's on the bag is it's filled with a little bit amount of fluid, and it's airtight, and it has in a normal person or in a normal condition, it has a negative pressure. Okay, just gonna draw again. See a pleura. And then when you pull it, when you pull the parietal pleura, okay, or try to expand them, when you try to expand them, the negative pressure inside this, like there will be more suction. When you try to expand the parietal pleura, it'll try to expand, and due to that, there will be more suction pressure. So there will the negative pressure will increase, right? Okay. So the pressure here, we call this the intrapleural pressure. The negative pressure. Okay. The pressure inside of the pleural cavity. We call this the intrapleural pressure. As I said earlier, the intrapleural pressure are in a normal person or in a normal condition, it's always negative, right? But during inspiration or when the rib cage tries to expand, the intrapleural pressure increases. Okay, and then we will have the alveoli inside of the lungs, right? These alveoli, when they expand, so it has a little bit amount of air inside, and due to that, when they expand, there will be like there will be more space inside of the alveoli. So due to that, there will be a negative pressure while inspiring, right? So this negative pressure will try to pull everything into that. So including the alveoli, it tries to collapse, like it tries to compress the alveoli, or it tries to get the air inside. If it successfully gets the air inside, then the alveolar pressure becomes zero there. Okay. I'm just saying it because I just want to explain what transpulmonary pressure means. Okay. So I have told you about the intrapleural pressure and the alveolar pressure. Okay, now I'm just going to talk about the transpulmonary pressure. These two pressure, alveolar pressure, the alveolar pressure is created by the air inside of the alveoli. Okay. We'll talk about the elastic properties of lungs and the surface tension in a bit. Okay. When it comes to the transpulmonary pressure, the difference between the intrapleural pressure and the alveolar pressure is called as transpulmonary pressure. Okay, why do we have to know about this? Since if this becomes negative, if the pleural pressure becomes more negative, it tries to, like, the lungs tries to expand, right? This one arrow. Okay. One arrow, okay. But then, due to the alveoli tries to expand. Due to that, there will be a negative pressure created inside of alveoli, which causes the alveoli to collapse or try to compress. Right? So there will be a small arrow inwards. Okay. So what we are going to do is that we're going to see the net pressure during expiration. So this is a bigger arrow here, and there's a smaller arrow here. I could have spoken with the numbers, but yeah. So if the transpulmonary pressure is positive, then the lung will expand, or I would say it helps in expanding, right? If it's negative, then it will try to collapse the lungs. I will just talk about how the transpulmonary pressure becomes negative, and then yeah. So what is transpulmonary pressure? Is the alveolar pressure minus intrapleural pressure. Okay, so I have told you that the intrapleural pressure are always negative. Okay, and the alveolar pressure in the initial stage it's 0. Then when it expands, it becomes negative. So intrapleural pressure negative becomes positive. Okay, alveolar pressure. Yeah, alveolar pressure and the intrapleural pressure becomes positive. And the alveolar pressure, say for example, the negative, but it's really less. So the transpulmonary pressure is mostly commonly is positive. Let me talk about the graph. During inspiration, during expiration. This is time. Okay, let me. It's 0. Okay, so during inspiration, the alveoli tries to expand. So then what happens is that it goes to negative pressure. Here it's -1. And then it becomes 0 as when it expands fully, and then in a rest stage. Okay. And then afterwards, it gets compressed during expiration due to the elastic recall. I'll talk about it in a bit. So what happens is that the pressure inside of the alveoli tends to become positive, and then again 0, because the lungs are fully collapsed and the air inside of the alveoli gets out of the alveoli. And then we will have the okay, this is the alveolar pressure. Okay, I'm just going to make sure it's in centimeter H2O. Okay, my bad, I didn't tell that. And then when it comes to the intrapleural pressure, it's more on the -5. And then during inspiration, it becomes about -7.5 to -8, and then again it becomes -5. Okay. So you might ask, like, why don't you why doesn't the during inspiration, why doesn't the intrapleural pressure become 0, to 5, like unlike the alveolar pressure? Is because during expansion, when it expands, the elastic recoil, the lungs are made up of elastic tissue. So when expanding, the elastic recoil increases, which causes the lungs tendency to collapse more. The lungs tendency to increase, to collapse, to increase. Oh, sorry. What I mean is that the lungs tendency to collapse increases. right? So during inspiration, this is your lung at the initial stage, and during inspiration, the lung expanded, and you have the pleura. Okay, let me show you another color. The parietal pleura and the visceral pleura. This is your lung at the initial stage, and this is your lung at the end. Now the lung tends to collapse more. So due to that, and because of the muscles contraction, the suction pressure increases. So yeah. So even though it comes to an halt, the suction pressure is always increased at the later stage of inspiration, and during expiration it decreases. Okay, so the difference, we call this the transpulmonary pressure, and this one is intrapleural pressure. Transpulmonary pressure is the difference between the alveolar pressure and the intrapleural pressure, right? So this is how the alveolar pressure changes, and this is how the intrapleural pressure changes. And according to that, the transpulmonary pressure changes. So this is the transpulmonary pressure is the net pressure, which helps the lungs to expand. And then now we'll talk about what are the pressure that tends to collapse the lungs. We call this the elastic properties. Yeah. Okay. So the elastic recoil created by the tissues of lungs, the tissues in the lungs. Elastic force created by the lung tissues. Okay. And then, okay, so we have like elastic fibers inside the lungs. So this is your initial stage when you have a rubber band, and then when you try to stretch it, it tends to collapse more. The tendency to collapse increases, right? And then we will have, and then I'll talk about the alveoli. Inside the alveoli, we have a thin layer of fluid covering the inner walls of the alveoli. And because of this fluid, there will be surface tension. Due to that, lungs tend to collapse. Right? So surface tension. The other force, the forces that tries to collapse the lungs are the surface tension and the elastic force by the lung tissues. Surface tension. Okay. So let's see. So we have seen the pressure inside of the pleural pressure. It's called this interpleural pressure, and the air pressure, the pressure created by the air, the alveolar pressure, and the pressure, the elastic force created by the elastic force created by the tissues inside of lungs. And then we will have the surface tension inside of the alveoli, okay, which tries to collapse the lungs. Okay. The alveolar pressure changes, right? The alveolar pressure means the air. It becomes positive or it becomes negative. But the pressure created by the surface tension uh, always tends to collapse the lungs, right? Okay. So the transfer pressure is the net pressure which we consider the intrapleural pressure and the alveolar pressure, the air inside of the alveoli. And then we will have the forces that tries to collapse the lungs, which are the elastic recoil and the surface tension. Okay, so if the transfer pressure is more than the elastic pressure, or the elastic pressure, uh, then the lungs tries to expand during inspiration, right? Where the transfer pressure is positive and really high, and the elastic recoil is lower. But during in the end stage of inspiration, the elastic recoil, the elastic pressure becomes more than the transfer pressure, because the muscles are relaxed, and the intrapleural pressure becomes less negative, so the transfer pressure becomes lesser, so lung which causes the lungs to compress. So transfer pressure. I'll just tell you about the clinical features. We could just think about it here. Okay. For example, if there is a problem in the muscles. Okay, wait, let me write it down. So we spoke about the muscles, give you a quick review, and then we spoke about the thoracic cage of the chest cavity. Okay, and then we spoke about the transmanular pressure or the pleura. Okay, lungs and the alveoli. In the pleura, we spoke about the transmanular pressure with the alveolar pressure. So transmanular pressure. Well, let me wait. I could say in the alveoli, the pressure created by the air and the pressure created by the fluid, which is surface tension. Okay. So we have seen what are the muscles, and if the muscles are paralyzed, for example, myasthenia gravis, the inspiration or the expiration will be really hard. Oh yeah, so I just forgot to tell about the expiration. So during expiration, during normal inspiration, the diaphragm, the main muscle that contracts is the diaphragm, and due to that, the vertical diameter increases. Okay, and the abdominal contents are pushed. So due to that, when you see while breathing, your stomach gets pushed outwards, or your abdominal area, my bad. Okay. So during normal expiration, because of the elastic recoil of the lungs, the lungs collapses by itself, like it compresses by itself. But during heavy breathing, what happens is that you inspire more air by increasing the vertical diameter, anteroposterior, and the lateral diameter, but then you will not be able to compress the lungs as much as before, because with only the elastic recoil, right? So you need other muscles to expire. Okay, so we have the abdominal recti, which causes the so what the abdominal recti does is that it pulls the lower ribs. We have the abdominal muscles here. Okay. So what they do is that they try to, when they contract, they try to pull the ribs downwards. So due to that, the lungs compresses, or I could say, as we have seen the bucket handle movement. Okay, and then we could say that abdominal recti and other abdominal muscle. What I mean is that, like, during contraction, they push the abdominal contents against the bottom of the diaphragm, which causes the diaphragm to go upwards and compress the lungs, basically. Okay, you can try it when you're deep breathing. So we have the chest cavity. We have kyphoscoliosis. So if there is an abnormality in the chest cavity, like kyphoscoliosis, it might be really hard. Like, the chest cavity might be smaller and it might be harder to expand, right? And the muscle weakness. And then we will have the pleura. And in the pleura, we will talk about the pneumothorax, hemothorax, pleuritis. I'll just talk about the clinical features in another video. So what pneumothorax basically does is that, in pneumothorax, what pneumo means, like, it means air, and the thorax means thoracic cage. What it does is that the air gets inside of the pleura, which causes the pleura to fill with air, which causes the pleura to become zero or sometimes positive. I'll just talk about it in clearly in another video. Okay, so due to that, the lungs tries to collapse. You can work it out by understanding what is intrapleural pressure, and like what happens if it becomes a zero, or what will happen if it becomes positive, right? Okay, and then when it comes to the lungs, we'll talk about the emphysema and fibrosis. Fibrosis means, like, when the lung tissues are, that the lung fibers inside the lungs are increased, then the elastic recoil of lung increases, so the person won't be able to breathe easily. Okay, and then we will talk about the emphysema, which causes the reduce the tissues inside of lungs, which causes the lungs to easily expand. Okay, it comes under, I'll just talk about it in a clinical feature, in a clinical video, about the obstructive pulmonary disease and the restrictive pulmonary diseases. But now it's pulmonary fibrosis, and emphysema. Okay, so in the surface tension, we can talk about. I'll just talk about the surface tension and how to reduce them inside of alveoli. Because we need to reduce the surface tension, or else the lungs start to collapse. So we have something called surfactant. So if the surfactant are low, then the surface tension inside of alveoli becomes more. Okay, so in a grown adult, the surfactant are in a normal amount, or in a normal adult, or in a normal person, the surfactant lowers the surface tension by many folds, right? But then in neonatal distress syndrome, so respiratory the neonates won't have surfactant, like fully developed cells. No, sorry, like surfactant won't be released fully. So what happens is that the surface tension in the neonates are more, which causes the lungs to alveoli to collapse. So that might be a problem there. Okay, that is it.